news coming in from Karnataka that 24 patients died in the Chamarajanagar government hospital, and there are also reports that for 2 hours between midnight to 2 a.m. There was no oxygen at that hospital, that the supply ran short. An inquiry has been ordered. Let's go across to Maya Sharma now for more. Maya, what are the details? What do we know at this point?
At this point of time, it is of course confirmed that 24 patients at the Chamarajanagar district hospital in southern Karnataka did die over the course of yesterday. Officials I spoke to did not want to confirm the cause of death. There were, of course, some protests also, very disturbed relatives outside the hospital, but the SP of the district confirmed that the protests were small and that they were in fact being managed with adequate personnel at the site, that they were not really major protests. Chief Minister B.S. Yediyurappa has also called up district officials after the incident to find out what happened, find out the details of that, and he's also called for an emergency cabinet meeting tomorrow at 4 p.m. Now, Chamarajanagar district for a long time at the beginning of the pandemic last year had no single case of COVID-19 at all. But since then, it has recorded 11,928 cases with 167 deaths reported till yesterday. And it had 2,644 active cases in the data released on Monday evening. But the tragedy there of 24 patients in that district hospital, the government hospital in Chamarajanagar, dying over the course of yesterday, and an inquiry on to find out the cause of those deaths, those tragic deaths, with, of course, devastated families left behind in the southern Karnataka district.
Right, Maya, and reports that the oxygen ran out for 2 hours in the middle of the night. There are also some reports which claim that the supply of oxygen from Mysore did not take place. What has the oxygen situation been like in Karnataka? Have there been concerns like we're seeing in Delhi over hospitals running out of oxygen?
There have been huge concerns, especially in capital Bengaluru, which has well over 2.5 lakh active cases. The government has, of course, been saying from the start that it does have enough oxygen. It is producing enough oxygen. Steel plants have also been asked to divert their oxygen to medical supplies. And there is, in fact, a war room set up specifically for oxygen demand and supply, specifically set up with a nodal officer, with somebody in charge to make sure that oxygen demands are met. But still on social media, you're still seeing those signs for people looking for an ICU bed, looking for an oxygenated bed, looking for oxygen and refills, trying to set up oxygen facilities at their home, because given the huge number of cases the city is seeing, Bengaluru in particular reporting oxygen shortages, the districts have not so far seen such a crisis, as numbers are lower in the districts, but of course with the situation worsening there, oxygen is a challenge everywhere.